And so we wanted to touch on different financing alternatives to help manage your business or organization through these challenging times. So today we're going to walk through just the introduction of where the current state of the capital markets are, going through some of the government programs and resources available, and those are changing, even hourly, definitely daily, especially over the last 2 weeks, and then kind of walking through some of the non-government alternatives that are available, and finishing up overview and having some questions. So I appreciate everybody joining us from around the country today. As Catherine mentioned, boutique healthcare investment bank focusing small middle market providers and service companies. We are working nationally with, I think a lot of the listeners, hospitals, nursing homes, senior housing, as well as a lot of revenue cycle and billing. We're based in Columbus, but work nationally. As we begin and touch on, cash flow is king. Cash is very important, and the volatility this past month in March, since really seeing the kickoff, and we saw it here in Columbus with the governor taking I think an early lead in the country by shutting down one of the bigger events, the Arnold Fitness Expo, 1st of March, and that was really a dramatic kickoff where internationally over 200,000 people traveled to Columbus for this fitness expo show, and that ultimately was very challenging for businesses that had already making the trek to Columbus. But I think it was a smart move looking in hindsight to that. And as we see Ohio, trying to stave off the challenges many other states are seeing with overload in the hospitals and systems, and this fear of the spike and availability of beds and supplies across. It's been almost a free for all to try to make sure that you're prepared, the hospitals are prepared, and you have a good plan in place. With that being said, a lot of the imposed government sanctions on reducing operations and forcing an outlook uncertainty to not only the economic and business, but many healthcare businesses, and we're seeing that within the not-for-profit, with several of the rating agencies dropping from stable to negative on the outlook. Obviously, your business is shut down or concerned about future billings, cash in the next 90 to 120 days, very concerning, as operations, many are really focused on elective surgeries, and with that really being eliminated, a lot of concern over how to pay the bills in the near term. As we get into then talking about some of the credit concerns then of that, and what that means for the lenders, and we're seeing a pullback by many that the uncertainty, they want to have a wait and hold approach to lending. Maybe they're good quality clients right now, continue to lend to, and we'll get into a little bit of that. But we've been talking to our clients about trying to get their lines of credit and get working capital available. We're definitely seeing a run on the municipal bond funds, working capital lines, really stock market. Obviously, we've seen a big drop as well. And so I want to turn it over to Dave to kind of talk a little bit more about the details, some of the capital markets and what we're seeing.
Well, thanks, Neil. Can you move the next slide? Thanks. As Neil mentioned, things are very fluid right now. This particular graph, I think, illustrates a little bit about where things have been. These two indexes, the SIFMA is a track of variable rate municipal bonds versus the LIBOR, which for short is a track of the sort of taxable rates and taxable indexes. As you can see, right there around the 1st of March, we had a giant spike in the SIFMA, where people started really looking at the uncertainties around what's going on with the virus, and I think that the reality of some of those impacts were starting to hit some folks. And, as you can see, the next, over the last week or so, that's come back down, into a more manageable area, as I think the timing of some things are starting to really hit people. And, maybe the total level of uncertainty has dropped. And I think that's really what you're looking at in that giant spike right there is it's sort of a measure of market uncertainty. And also, when we see uncertain markets, you see credit officers getting very, very nervous about their lending and who they're lending to and how they're lending their money. And so, what generally happens is we get an immediate tightening in the credit markets, which you see is referenced here in this graph. And then, as people sort of get a handle on things, the purse strings sort of loosen up a little bit. But as you can see, they're not back to normal. The index is still what we would call inverted. That blue line really should be below the gray line in most of these situations. So with that, why don't you move to the next slide, Neil, and we can talk a little bit about what's going on.
Note on there, obviously with credit tightening, lack of liquidity, and so therefore the rate spiking and seeing some of those auction rate bonds again get repriced where there's no buyers out there, and the rate spike to the maximum amount of 10 or 12% from maybe low single digits, and that can be very concerning for those borrowing large amounts. Some of the hospitals that may be out there.
This is just briefly is a juxtaposition of the U.S. prime rate versus the 10-year Treasury, and I think this brings things a little bit closer to home. Those of you who have a long-term fixed rate mortgage, most U.S. mortgage rates are based off of the 10-year index on U.S. government bonds. So you generally are looking for a low 10-year rate, but if you look here, the prime rate is held steady for quite some time. We were slowly building back up to some historical norms. The Fed was, as you may recall, had been slowly ratcheting those up in order to give them a little bit of breathing room in case something were to happen in the credit markets. And well, guess what? There you can see the Fed rate, the federal funds rate coming down, the prime rate coming down, and as you can see, also the flight to quality is what we call that, with the 10-year, that yellow line taking a significant dip there at the end of the graph. Really, it reflects a couple of things. It shows that a lot of larger investors are moving out of equities and moving into bonds, and this is very typical supply and demand behavior, where we've got a lot of buyers and not as much product, a consistent supply, which then makes the yield on that supply go down. So another way to say that would be just people are willing to take less in return in order to have a guaranteed return. And in this graph shows the Dow Jones and what's happened with the Dow Jones Industrial Average over the last 4 months. It's been a bit of a rocky ride, so on this one we've added the VIX, which is a volatility measure, and shows the differential in the bid-ask price for different securities. In this case, it's indexed to the Dow, and as you can see, it's almost a mirror image of the value of the Dow Jones Industrial Average. And again, what this shows is as that VIX goes up, it's another measure of uncertainty. It's people not knowing how to value the future of various stocks, and it's concerning that the higher the volatility, the more uncertainty you see in the market. And as you can see, that in that steady downward tick in the market, that really shows where people were as of 2 weeks ago or 3 weeks ago. Fortunately for us, it started to come back a little bit as people are starting to get a better handle on what's happening in the overall economy, but also more particularly in the healthcare sector, in really kind of understanding what the long haul, for the country is in terms of the COVID-19 sequestration or social distancing, however you want to put that, and really trying to understand what what the implications are of, having the workforce basically, at home or working from home for 3 to 4 months.
I will note in there, I think the VIX, which touched just over 80 this recent past, during the 2008-9 recession, that it really peaked at, I think, no more than 60. And so just to give a reference point of where it is today and where it was, about 10, 12 years ago.
Yeah, and just to understand that it's unprecedented, really, in terms of volatility and, just sort of the uncertainty factor of what this means.
So as many providers are now coming to this, what we call fiscal cliff, a reduction of services, your receivables that you build out December, January, February now are collecting out, and going forward, it's uncertain or very limited to what you've been billing out in February and March. And so with that, planning, scheduling, making sure that you're altering your business model as long as you're a critical, essential provider, or moving to, we're seeing a lot of cases, the telehealth, which is at least some generation of revenue servicing your clients and patients, but obviously not getting facility charges and doing a lot of the higher revenue services. The next 6 weeks are still very unknown. The government forced shutdowns. I believe now every state has essentially put a stay in place order. Concerns about further breakouts at some point. Everything that we're seeing in the weekend's been positive this past week with flattening of the curve, but there's still a couple of these breakouts that are in Detroit, I think even Milwaukee, of course, Louisiana, some of these other markets that they seem to have them slightly under control, but still some unknown there. And everybody wants to know when can we get back to work? When can we open up? That's a big question yet as of today. A lot of debate over that. Still seeing great support by a lot of companies out there helping do what they can to source material to help produce it as best they can to the quality that's necessary for those on the front line and the patients out there. Shortages of the staff, a lot of the physicians and nurses that are putting their lives, out every day. And, it's unfortunate when those that are stepping up and doing that have lost their lives. And, we thank them for that. But we are fighting this and making the turn. And so as a business, you need to kind of keep an eye on those indicators, consider looking at your 2020 budget, revisiting that, and as we'll see in a minute, consider even looking out to 2021. As cash is tight, there's what we call the 13-week cash flow, looking out weekly on all of your revenue and expenses so that you can manage down to essentially the dollar. And then accordingly, make sure you staff accordingly. And we'll talk about some of the programs and the plan of whether to keep some of the staff on there, paying them with, for example, the PPP grant funding, and making sure that you are managing your cash and still managing the business, which can be very challenging and difficult. But running into that conversation, Dave, you want to talk about the chart here?
Yeah, well, we're calling this the roller coaster. We stole, in all credit where it's due, we stole this from Morgan Stanley, but I think it's a very nice illustration of really what to expect going forward, with the waves of infection, and as well as looking at from a financial standpoint, how do we prepare, or how do we get through this one, and how do we prepare for the next wave? And looking at it just at a high level, we're sort of in the middle of this peaking right now, and now through mid-May, and then as things come back down, hopefully, and I'm not in a position, we're finance guys, I'm not going to try to speak to antiviral test results or testing capacity or any of that stuff. That's not our bailiwick. But understanding largely what this graph means from a financing standpoint is, we need to prepare for a bit of an extended term of people not working and lowered revenues, whether you're a physician's office, a dental practice, even to a certain extent, home hospice, health, home health. I mean, we need to be ready to dig in a little bit for the long term here. And really, if you kind of look at the graph, they're suggesting June as a time to get back into sort of more normal operations. Well, what does that mean? How do I plan my cash outlays? Who do I pay? Who don't I pay? Those are questions that we really need to start asking ourselves as healthcare finance professionals, in terms of the revenue piece of this is going to be largely fixed for a while. Hopefully, again, come June, we can restart the machine here a little bit and really get back to business as usual. And as you look, though, we're seeing the second hump coming in the fall once the kids go back to school, and that's something we need to be prepared for. And what they don't show is, again, if we do not have a viable vaccine, we might be looking at another hump, coming again and again. So this is why we call it the roller coaster. It's really like your traditional roller coaster. You come out of the gate, you kind of crank up that hill, and then you go shooting down, and then you hit a couple more bumps before you come back to the station and you're allowed to get off. I think we'd all really like to get off this ride as soon as we can, but as you can see, this may be and I think is likely to be a mid 2021 time frame before we can get off of this thing.
That's a little scary to think, Dave, but I just don't. I kind of agree. I think June is tough. I think we need to get maybe the economy open a little sooner to some extent. Cautiously optimistic that that's the case to a certain degree, but I don't see the travel coming back that quickly with the risk still out there. I don't see families wanting to take the kids and going to Disney World this summer after their retirement account just took a hit and they may or may not be fully employed. And a lot of uncertainty still.
Well, yeah, that's I don't disagree with you, Neil. I think that consumer behavior is going to change for the near term, at least. And until we get a handle on this, I suspect that you're going to see a large hesitation on the part of most consumers in the area of discretionary spending on travel, on leisure activities, on any of the sort of discretionary income pieces that we would typically see a lot of marginal revenue on. The other thing is, the question is, with historic unemployment right now, what does that mean for healthcare providers? What is the last number I saw was somewhere in the neighborhood of 10 million people have lost their jobs and also their health insurance in relation to this. And I don't want to get political about it, but I think that is going to have a significant impact on physician practices, dental practices, with 10 million people without healthcare benefits right now. That's going to be
those elective surgeries that everybody's hoping that'll all of a sudden bounce back and be extra busy and add extra days. That, if you don't have insurance, you may want to put those off to help wait until you're employed again. So that's a good point. So as we talk about, again, trying to manage potential uncertainty of this roller coaster, cash is key, staying liquid, planning. We've had clients starting to receive money in, just making sure, working through with them that, it's prudent not to go ahead and spend that money. We need to plan it out and be disciplined. Talk to your bank, your lender. You're probably in default or will be here shortly. And with that, having that conversation, extending the lines of credit, or at least working through knowing that the cash should be available, and try to get as much as possible.
Well, and I think, now's a point to step and talk about that. I mean, even if you're still paying on whatever debt you have, we're really talking about covenant defaults here, and sort of most commercial lending documents have some type of debt service cover requirement, or days cash on hand requirement for hospitals and other healthcare providers. I suspect those of you who've received your advanced Medicaid funding, or some of the other programs we'll talk about, may be okay for a little while, but again, I do think you need to really, now is the time to have those discussions with your lender to talk about what happens in the event that we start breaking some of those covenants. Because again, I don't know that there's a whole lot that you as a provider can do at this point. Everyone I've talked to anyway is doing everything that they can in order to generate revenue, whether it's implementing telemedicine to a much larger extent than they have, or streamlining operations, trying to go as much utilizing staff as efficiently as possible in all of those sorts of back end pieces. But at some point, we expect that the majority of at least mid-sized to smaller hospital operators will end up in a covenant default situation. The math that we've run just indicates that seems to be the case. As soon as billings run out, we're about 30 days from the last time most folks have been operating at full capacity, and especially those guys who were working with 7 to 10 days cash on hand already, are likely to start seeing some covenant defaults. I would be surprised if your lender or bond trustee or whoever is controlling that debt really does much about it. I think, though, it is something you need to be aware of. I don't think any lender at this point really wants to be on the front page of the Wall Street Journal for trying to foreclose on a hospital working through COVID cases. But on the same token, it is the time to talk to those guys about the situation you're in, so that we can create some constructive progress, and everybody's clear on how that's going to be handled. Anyway, I didn't mean to cut you off, Neil. I apologize.
No, that's a good point. But at the end of the day, the bank's dealing with a lot of situations. They know everybody's in it, and so there is kind of that 90-day put that they will give you time, as long as you're showing that you're properly putting a plan together, working to try to get manage the business and get the funding to get through. But you need to collect your receivables and manage your vendors and payables. Work on negotiating, extending out. I mean, we saw in mid-March with a developer client with several physician groups, that physician groups already told them they were not going to pay the April rent. And so being very proactive with some of the larger groups, and medical supplies, seeing the costs go up, the availability to even get them. And then on the employee side, very difficult decisions to furlough or let go. Many maybe were the temporary or frontline, but the management teams and other critical employees were seeing pay cuts or temporary furloughs. And even talking about physicians with fixed payment arrangements, that having that tough conversation, going back to them and saying, hey, we need help. We need you to work with us. I know we agreed on a fixed amount, but we need to push that off a little bit, maybe take a 20-30% cut for an interim period of time. So we're definitely seeing that across the board.
Yeah. So now that we've scared you, let's talk about what's happening. Ways that we can work with the new legislation that Congress has passed and is now active, in order to really find some ways to ameliorate these problems. I think everyone is now by now very familiar with the CARES Act. The Families First Coronavirus Response Act, also working from the bottom up on this slide, also is out there. It is designed really to aid families and employees, and we'll talk about some of the pieces of that, as well as the Corona Preparedness and Response Supplemental Appropriations Act, which really, I think is particularly helpful for hospitals and healthcare systems that are need to implement more telemedicine. The emergency appropriations, I think, are largely in place on that 8.3 billion. I think the most of our discussion here will really focus on the CARES Act and what really how do we utilize those funding sources to get through this situation. The CARES Act, again, it's $100 billion in or $100 billion in public health and social emergency fund for hospitals and physicians. The article link there is from McGuire Woods. It's a nice synopsis of what's happening there as of last week. On Friday, the Department of Public Health and Human Services began distributing the first 30 million out of that fund. I think they still have 70 billion to distribute. They're still working on all of the details of how that remaining 70 billion is going to come out. Those of you who do a fair amount of Medicare work should start seeing money. If you haven't already seen it, you should start seeing it this week. Again, the HHS used Medicare billing as a benchmark, for this first 30 billion that's coming out. You should sort of see your pro rata share of that, anytime if you haven't already.
And Dave, it looks like there was some discussions. Do they do it per bed? There was a little back and forth, but ultimately it's about 6% of what 2019 fee-for-service Medicare billing was. And then obviously, there's strings attached, of course. So they're sending you the money, but our understanding is then you have 30 days to go on and whether to accept that money or agree to return it and accept the use of the funds. And so go ahead and feel free to contact us or look that up, speak with you.
Yeah, and again, that your accounting departments should have that stuff. It's direct deposited directly into your Medicare account. That should be there. The nice thing about it is it's a relatively easy number to calculate when we're not, you don't really have to guess too much about what that number should be. And again, as we mentioned, that's really just the first line of distribution there, and is really geared toward primarily hospitals. As we move forward, I think individual practices and those billings should be in the second wave of this going forward. It's they're really looking to find other ways to address things like pediatricians who obviously aren't dealing with Medicare, but really also provide this vital service, and how to distribute to those sorts of folks. Stay tuned for that. I do expect something to come out by the end of the week, on how that's going to happen. But we'll see. So go back. Just moving on. I do want to just say, as we move forward, the 1 billion to the Defense Production Act, will hopefully at some point here in the near future address some of the PPE requirements that we've seen, or the shortages that we've seen. The Medicare reimbursement increase, I think everyone's probably already familiar with that, but also very important. And then the sequester situation, and repealing the sequester is also hugely important, and will help those of us who deal with people on Medicaid on a regular basis, that will again hopefully ease some of the pressure for those of us serving lower income communities and the elderly. So go ahead. So again, the CMS accelerated and advanced payment programs. You guys, those of you who are going to benefit from this. Most of our clients at this point, I think all of them, I'm not positive, but I'm fairly certain that the vast majority of our clients have already received their funds from this. One of the nice things we've discovered is, you don't really have to guess with this. The MACs already know what you're eligible for, and as you're filling out the registration forms, we've been advised from a couple of our clients that they will accept, we'd like the maximum we're eligible for as the amount in the blank of the form. So, you don't have to guess, you don't have to, go back and try to, guess how much
Save a lot of
CMS is
times trying to
authorized.
figure out, understand, and makes it easier just fill in, max amount requested.
Yeah, we were part of a conversation with one of our clients. It was one of the most surreal conversations I've had in a while, where, their payment process, their processor, was like, yeah, we know, I'm not allowed to tell you, but we know how much you're eligible for. CMS told us, but we're not allowed to tell you. And so, that was a little bit, typical government at work there. But that process seems to have gone relatively smoothly, at least for the folks that we've been working with. If you have been having issues, we'd like to hear about it, just so that we get our finger on what's happening on that side. But like I said, this program, the rollout of this, at least initially, seems to have been fairly smooth. We have heard through the grapevine that there may be some relief for smaller hospitals that may not be able to make the repayments quite on schedule. The secretary came out, was it in middle of last week, I think, and in talking to some industry folks, seemed to imply that we may be able to get a 30% reduction in the required payback if we can show a certain level of financial distress. That that still, none of that has been put in writing that I'm aware of at this point, but there is some hope there for folks. And I do think you should not be afraid to take this money, based on the repayment requirements. It sounds to me that CMS and the rest of the government at this point, seems to be very willing to work with providers, at least on this program, to structure things so that, either some portion of it may be forgiven, or, we can work through the repayment provisions. I think what is it, 1%, you have, almost, it works out to be like 18 months, until you really have to pay it back. And once that, once we get there, I think the repayment interest rate's like 1%. So it sort of behooves you to, hold off on that as long as you can. Again, a little bit more information in regard to the advanced payments program. I think, again, most of us, or most people on the line, have already processed a good portion of this, but if you haven't, there's a little bit more information to help you along there. I included this slide just because I do like this website. I think it's a great resource in terms of just having everything on one page. There really isn't a whole lot of additional information here. It's all of the non-clinical stuff. It's billing, it's coding, it's certification. How do you report all of this stuff? But it's a nice resource on the nitty gritty of how you handle all the back end stuff with this. So that's
I
the
like the picture of the more delighted, happy nurses than some of the ones that we've been seeing after kind of going through war, and seeing a lot of those on the internet lately of what they're going through on very extended days and just grueling situations. And we have some family friends that are definitely frontline, seeing and experiencing and helping out however best they can. But as some of these programs you may have applied for or looked at, the CARES Act, the PPP is the big one that has had significant number of changes over the last 2 weeks since it came out. Obviously, this one is through the SBA lenders working with a bank. Some of the larger ones may have some caps on it. Definitely seeing some of our clients already getting funding in late last week that has been very necessary to continue operations. Capped at 10 million, roughly 2.5 months as you calculate through your payroll. Capped off at any employees that are making 100,000, no international employees. They did cut the 1099, and so no consultants. It is employees and some of the other benefits associated with that in terms of the calculation. Also be used for rent, mortgage, as you see, some loan interest selectively, as well as utilities. Really the purpose of this, it is a loan, and then you can qualify. It established the rate at 1%. Set it over a couple of years, no payments. I believe, in my mind, I think it's for the first 6 months, if not, then maybe moved it to a year. Then you can apply also to have that converted into a grant and not repay it, as long as the money's used for those purposes as you outline. And so as we're having conversations with a lot of organizations that are they going to continue to employ and use the money to have their employees, big decision question mark that needs to be made between, do I take the money, continue to pay employees maybe to sit on the sidelines, or do I let them go to unemployment? Obviously, no personal guarantees, and you can pay that back, I believe, with no penalties at any time. Some of the questions that we've had come up are, how does this affect maybe existing covenants that we have as we take these loans? I think your bank is definitely going to work with you on through this, because they would prefer not to finance additional working capital today if they don't have to, and if the government's coming in kind of behind it. And then if you're working with your bank to get these programs, they actually make a little bit of money on the other side. So it's kind of a win-win at the end of the day to continue to work with organizations through this roller coaster. Also on there, we have the EIDL, economic injury disaster loans. There's the emergency grants, $10,000, which can be applied then to the PPP. Seeing many customers and companies apply for both the EIDL and the PPP. Now the funding available, and I think processing, the amount of applications has just been unprecedented. And I think to get through the system, it could take a while. I'm concerned that it may be too late for those to get through. I've not heard of anybody yet that has received an EIDL loan, but again, we are seeing some of the PPP coming through at this time. Dave, any other comments maybe I'm missing on these?
I think we've had a number of questions come through on the PPP in relation to sort of leased employees, or folks who use a POE, a payment processing, third-party payment processing group. As you mentioned, the 1099 employees have been largely excluded, but in the count, you can include employees covered under a POE, which I think sort of if you think about them as sort of leased employees, or folks who are not truly contract labor, but are sort of you're processing all of that payroll via a POE. those folks are definitely includable. And then all of that stuff is explained under the frequently asked questions. I think the SBA folks did a very nice job, sort of anticipating some of these issues and clarifying it. I definitely would recommend, if you're considering a PPP and haven't already submitted, take a look at the frequently asked questions, because it does clarify a whole host of issues that were, until this came out, a week or so ago, were very up in the air and were not handled. Nobody had any answers to them. So switching over to the USDA for a few minutes, unfortunately, we haven't seen a whole lot coming out of USDA for those of us in the rural sector. They did publish in the Federal Register last week that they will allow payment deferrals on federally guaranteed loans for a period of up to 180 days, which is nice. Now, it doesn't forgive any of it, but it does push it out a little bit, so that we, it allows us the cash that providers have to go a little bit farther. Gives us a little more space to ramp up operations and get moving before those debt service payments are triggered back in. One of the other pieces I would like to just mention here is that the distance learning and telemedicine grants are also, I think the application for that has expired already, and this year's grants are being determined. But this is a great way for for rural hospitals to really finance telemedicine extensions, in trying to really find efficient ways and effective ways to serve the rural population. It's a competitive program, but well, and maybe it's about to get a lot more competitive, I guess. But historically, it hasn't been quite as competitive as some of the others, and this is really a nice way to invest. It's $1 million of basically free cash to invest in those services. It does require a 15% match of non-government money, but again, I think that's something that most folks can figure out. Special considerations for municipally owned hospitals. We have several municipally owned clients. We're having some real difficulty with them, mostly because as written, they do not qualify for EIDL loans, nor do they qualify under the PPP as stated. We've, with several lobbying groups and industry groups, we are pushing very hard to correct this. I think they do fit under the general auspice of the Enabling Act, but because of the SBA and the way that the SBA is focused on small business, they have written the SBA regulations in such a way that municipally owned anything really doesn't qualify for SBA financing. Again, this is something we're working toward with some folks. Now would be the time to lobby your congressman or congressperson to push this forward to help our smaller hospitals. Additionally, there may be some relief under the CARES Act. As we discussed, the Federal Reserve and the Treasury have $554 billion in emergency loans available. They're still working out some of the details, but the Main Street lending and the municipal liquidity facilities should be able to provide some of these municipally owned hospitals with some types of financing. Again, it kind of goes back to a lot of these guys operate on a shoestring and on a very short cash position. So the amount of aid available there, may or may not be worth doing for you. It's something you really need to contact your city and your financial advisors to check into this and see if this is something that's worth pursuing.
Thanks, Dave. And so as we look at alternative funding solutions aside from the government programs. You got to think about lines of credit, based on your assets. That's the easiest way, as long as you can carve out maybe from bond covenants or other collateralized the receivables. That's the easy way, especially as you think about ramping the business back up. Many of our clients had normal bank lines, lower bank lines, but that's not going to be sufficient as you're ramping up once elective surgeries are allowed again. Equipment loans and leases. We recently funded a existing equipment, carved that out, and was able to do a sale-leaseback to provide some excess liquidity. As you look back, maybe even the past 6 months, possibly longer, of anything you purchased with cash, that's still eligible under many lenders to turn into a financing and pull that cash back out, put it on the balance sheet. I will say on the line of credit, we did work with a hospital recently on putting together a specialized financing for a single a receivable payment that was potentially excessively large from month to month. And so we were able to carve that out and help finance that as needed. Some months it was maybe $500,000, other months it was $5 million. So that could be very challenging to the cash flow. So there's different ways to get creative, especially with the non-bank lenders. Now you may pay a little more, but it's very limited, and using it as a tool, especially now, you need to think about the liquidity and have the cash available, then an extra few points of interest for the interim period. Self-pay receivables and bad debt. There's some good and bad characters out there, some quality organizations that you can finance those self-pay receivables, something to think about. And then your real estate portfolios of medical office buildings, surgery centers, doing joint ventures, leveraging up, working with a hospital now on a senior living facility that they have available that we're looking to carve out and leverage that to bring additional cash to the organization today. Much easier to finance a senior housing facility, medical office building, or other than a hospital, especially if you've had any challenging years or an outlook right now as a small community facility. Other areas to think about: home health, doing a joint venture or sale, physical therapy, other service divisions, even your revenue cycle or the back office. It's always very challenging to find and retain talent to operate billing and coding and collections. So that's an area where we can look to outsource and still retain many of your employees, just be trained and managed by an organization that has a lot more tools for that. And some of them will even consider to purchase or invest into that division. So happy to speak further about that. Something coming up I think we're seeing concerns about is really the foundations and donations and events, charity events. That's something to be concerned about, as the investments already have fallen with the funds at the hospitals and some of the expectation of the income with low interest rates and investments that help subsidize operation. Turn it over to you, Dave. I know you work with a lot of organizations in that respect.
Well, yeah, I think that as you mentioned, we talked about the state of the Dow Jones. The Dow Jones is really just a proxy for the stock market as a whole. But as we've seen, broad, just wholesale reductions in value, the annuities and the long-term investments by a lot of hospital foundations have really been undermined to a large extent. In the last 3 months, we've seen a significant reduction in the workforce as well, and so a lot of the people that would otherwise be giving I have no problem writing a check to to my hospital charity for $1,000. Well, now I'm not so certain about what my next where my next paycheck's coming in. I may cut that donation in half, or if I give anything at all. And so I think that we're really seeing a lot more hesitancy on the part of small and mid-sized donors. So to the extent that you rely on those folks to fund these things, expect a reduction in the next 12 months. The same thing, as economic capacity goes down, city and county revenues will also be lower. So anybody who is, getting help from their city or county or hospital district or other, other form of tax revenue, that's likely to decrease in a significant way as well. And we talked a little bit about, where to get some other funds. A lot of times, my background is largely in, in bonds of various sorts. People forget about, they've got these restricted funds on their books. Go back to your bond documents and see what you can use those funds for. They're there to be used as necessary. Don't be afraid to tap them. That's what they're for. Especially, debt service reserve funds, or if you have a repair and replacement fund of any sort. Now's a great time to raid those funds as available. One of the other things we talked about a little while ago is, see if you can get a county or city, those of you that are municipally owned anyway, can get a county or city limited guarantee on new financing. Doesn't have to necessarily be backed by tax revenues. There are a number of ways that we've financed these things without direct pledges of tax revenue, which in most places require a vote. So if we can avoid that, we really try to do that. Again, it really depends on your relationship with the county or city before we suggest going that route, but it's worth thinking about.
We really see a lot of creative situations working with maybe local banks, the city, county, and the hospital, because in most situations, especially more the community facilities, it's an important asset to the community, and working together to create a solution, especially during these times, is important. So, thinking outside the box and putting a plan together. Everybody wants to get it done, and a lot of times it's just spending the time to think outside the box for a solution.
Mm-hmm. And again, I don't think we really need to spend too much time here. We've just included a matrix of all of the programs we've discussed previously, where we have applications or other pieces that are relevant. We've tried to include that. That this is just really here for your reference. Should you, it's all in one place.
Thank you. So as we finish up, I think we're maybe just past time even. Prepare, be disciplined, and put together your cash flow. As cash is king, manage that cash, and take advantage of the opportunities for government programs, working with the banks to borrow the money, strengthening the balance sheet for this roller coaster ride that we're all riding together. And so working with your vendors, they understand, they should understand. There's a lot of options out there right now through these challenging times. So thank you. Appreciate your time today. Everybody's busy dealing on many fronts, and we thank you for your time to walk through some of these opportunities to help finance your healthcare organization today.